Welcome. Come in. Hi, I'm Kendra. I'm going to be your student nurse today. And then I put on some gloves. Can you tell me your full name?
Morgan Snow,
And your date of birth?
4/14/2000.
Alright, and let's see your medical record number and make sure that her name, date of birth, and medical record number all match what I have in my chart. Do you have any allergies, Morgan?
No.
Any medications?
No.
Food?
No.
Latex?
No.
Tape?
No.
Or any environmental?
No.
Okay, and let's take a look at your vital signs today. You have a blood pressure of 120/78, a heart rate of 72, which are both normal, a respiration rate of 18, and an oxygen saturation of 99, which is normal, and a temperature of 98.7, which is also normal. So you're all good there. Do you have any pain today, Morgan?
Yes, in my foot.
All right, and when did this happen?
About 2 days ago.
Okay, and is it constant? Is it
Constant.
It's constant, okay. And is it on the top or bottom or your ankle? Okay, it's in your ankle. And can you tell me how the pain feels?
It's sharp.
Sharp pain. Okay, and is there anything that makes it worse?
Running off.
Okay, and anything that makes it better?
Elevating it.
Okay, and other than elevating it, is there anything you've done to treat it? Advil. Okay, and on a scale from 0 to 10, 0 being no pain, and then 10 being the worst pain ever, how would you rate your pain?
Out of 6.
Okay. And so Morgan is alert. She's answering my questions. She's sitting up straight. She's symmetrical bilaterally. She told me her full name. Do you know what today is, Morgan?
Thursday.
And do you know where you are?
The hospital.
And why are you here?
Because I hurt my foot.
Okay, so she's oriented to person, place, and time. Okay, so I'm just going to go ahead and check your equipment here. I'm going to check your nasal cannula. Make sure there's no breakdown behind your ears. This looks good. No breakdown there either. I'm going to check your nose. No breakdown there. Does it feel comfortable for you? Okay, and then I would check for any kinks in the tubing. I would check the wall to make sure that it's hooked up properly and that the flow rate matches the provider's orders. And I'm going to go ahead and check your IV. Is there anything? No. There's no redness, erythema, no swelling. And I would check to also make sure that there's no kinks in that tubing and that it's hooked up correctly and according to the patient or the provider's orders. I don't see a urinary catheter, but if I did, I would assess that accordingly. All right, Morgan, I'm going to go ahead and check your hair and your head. Okay, hair is clean and neat. It's pretty even. There seems to be no lesions, no dryness on the scalp, which is good. All right, I'm going to go ahead and check your skin. Okay, skin is warm and even. Skin color is even and consistent with her ethnicity. Go ahead and check your skin temperature. It's normal. And capillary refill is within 3 seconds, which is good. Okay, and then I go ahead and make sure there's no pitting, no edema. So you're good there. All right, so I'm going to go ahead and check your ears again. I'm going to check for any drainage, any discharge or breakdown. That looks good. There's a piercing, but it looks pretty healthy. No breakdown or just discharge there, which is good. Go ahead and look up for me. All right, and there's no drainage or discharge in her nose, but if there was, I would assess the color and consistency of that. There's no lesions in the nose either. All right, Morgan, can you go like this for me and look at the wall? Okay, and can you follow my pen? Okay, so her pupils are equal, round, and reactive to light, and they converge and accommodate movement. And I'm going to pull down on your eyes here. And your conjunctiva, seeing pink and moist, and the sclera is clear, which is good. Can you open your mouth for me? Okay, so there's no dentures, no apparent lesions. The mucous membranes seem pink and moist, which is good. And can you go ahead and smile for me? And her face is symmetrical, so she's got good motor use everywhere in her face. All right, so she seems to be in no distress at all. There's no accessory muscle use in her breathing. Are you breathing okay today, Morgan? Okay. And can turn around, I'm going to listen to your lungs. Usually she would just be laying in bed. I wouldn't have her turn around. And for the purposes of this video, she's going to keep her clothes on, but usually I would do this beneath the clothes. All right, when my stethoscope touches your skin, go ahead and take a deep breath for me. Okay, so her breathing sounds normal and clear. There's no adventitious sounds, which is good. If she had an incentive spirometer, I would teach her how to use it and ask her to repeat it back to me to make sure that she indeed knows how to use it. All right, Morgan, I'm just going to feel your pulses now. Okay, got it. Move back to your wrists. Okay, and then move yourselves. Okay, those are all normal and equal bilaterally. There's no thrills present at all. And normally I would palpate her PMI, which is at the 5th intercostal space, mid-clavicular line. But for the purposes of this video, we won't do that. All right, so I'm going to go ahead and listen to your pulse here. And I'm going to tell you to take a deep breath and just hold it so I can hear. And for this, I'm going to use the bell of my stethoscope. All right, so take a deep breath and hold. Okay, deep breath and hold. Okay. So I would be listening for any bruits, which I didn't hear, which is good. All right, I'm going to go ahead and listen to your heart now. I'm going to listen to her aortic, which is the 2nd intercostal space in the right sternal border, and then move to the pulmonic, which is the 2nd intercostal space, left sternal border, and then down to Erb's point, which is the 3rd intercostal space, left sternal border, and then down to the tricuspid, which is the 4th intercostal space, left sternal border. And usually I would auscultate her mitral, which is the 5th intercostal space, mid-clavicular line. But for the purposes of this video, I'm not going to do that. And also, I would usually do this straight on the skin, but for the purposes of this video, she's going to keep her clothes on. All right, we're going to go ahead and listen to her now. And I would also do this with the diaphragm and bell of my stethoscope. All right. Okay, so S1 and S2 sounds are present. The rate and rhythm of breathing are normal, and there's no extra heart sounds like the S2 and the S3. So then I'm going to go ahead and ask you if you have any numbness, tingling, or swelling in any of your extremities at all. No? Okay. And can you go ahead and squeeze the hand? All right, and pull towards you. Okay. And then push towards me. Okay. All right. And then can you go ahead and lift your feet up and push down? Okay. So the strength of her muscles is 5 out of 5. She has full range of motion against gravity and against resistance. All right, Morgan, that completes my assessment today. Your call button is right here. Do you have any questions for me?
Nope.
All right, just let me know if you need anything. Thank you.